Welcome to Medical Breakthroughs. I'm Dr. Dean Adele. Every time you take a step, your knees bear more than their fair share of the burden. Think about this. Every pound you weigh translates into 4 to 7 pounds of pressure on the knee. For a 150-pound person, that can be as much as 1,050 pounds of pressure per step. So when osteoarthritis attacks the knee, we look for ways to hit back.
I would go home and crawl up the stairs, literally using my feet.
My bones tend to, it sounds gross, but grind together.
More than 20 million Americans suffer with osteoarthritis. And as baby boomers get older,
in 2030, that number is predicted to be 67 million people in the United States.
age causes it. So can traumatic injury and genetic factors, but the bottom line is the same.
Through progressive wear and tear and breakdown of the cartilage, you lose the cushioning effect of the cartilage inside the joints.
And some joints, like the knees, take it harder than others.
We don't give our knees a rest. We're on our knees all day, every day. We walk up and down stairs, walk up and down hills, get in and out of chairs, and it's a major weight-bearing joint in the body.
There's no cure, so when pain starts, people reach first for common remedies like aspirin, acetaminophen, ibuprofen, and naproxen.
They have side effects. They can cause stomach ulcers. They can cause problems with kidney function. They can also cause problems with the liver.
People are much more interested in taking something that is directed at where their problem is.
Like a shot of relief delivered right where it hurts. Our bodies naturally produce a substance called hyaluronic acid, or hyaluronate.
It acts as a shock absorber per se. It also has important effects we're finding on the cartilage and on the lining of the knee.
When osteoarthritis attacks, hyaluronic acid thins out. Injecting it back into the knee relubricates the joint.
They have the ability to help with pain control inside a joint. They've been shown to help with stiffness and alleviating stiffness within the surrounding tissues.
A series of shots over the course of several weeks can provide relief for 6 months or more.
Your bones don't grind together, you're more flexible, you just are much more comfortable. You're willing to go out and do more things.
Hyaluronate shots can be derived from animal proteins, so in some patients it causes swelling or allergic reactions. A newer process allows bioengineers to create it from harmless bacteria using a process called biofermentation. Studies have found it to provide better symptom relief with fewer adverse reactions.
It's not produced by using chickens or roosters or any animal product, and that's the advantage.
The claims are that they are 99.9% free of any detectable impurities.
Thank you, Christopher. Knife, please.
For 1 in 4 patients, though, surgery is inevitable.
There's been a lot of advances, obviously, in the almost 20 years that I've been doing knee replacement.
Until recently, surgeons had only a few knee sizes to choose from.
We don't cut the muscle like we did in the old days.
The advanced stature knee offers a more custom fit.
This is a knee that's shaped a little bit different depending not only on your gender but on your stature. And you can see the difference in the width of the implants. Before we had to compromise on sort of this fits okay, but it's not perfect. Now we can say that things are getting pretty close to fitting perfect.
For Kelly Kirkbride, it means being able to do simple things most of us take for granted.
I can go upstairs. I can walk a few blocks. I can get up and down out of a chair.
Despite these advances, lifestyle goes a long way in helping protect joints.
Diet and exercise should be at the top of the list of things to do for patients with osteoarthritis.
Remember what we said at the beginning? Every pound of body weight is multiplied in terms of pressure on the knees, so extra weight is an obvious enemy.
You get them to lose weight, you get them on an exercise protocol, and many have less pain.
The Arthritis Foundation recommends regular walking,
Pull with those arms and move with those legs.
swimming or aquatic exercise, even golf, because it's easily adapted to individual capabilities.
But if they'll contribute to their own treatment, the results of their treatment will be much, much better.
Early diagnosis will help control the painful symptoms of osteoarthritis. If you have joint tenderness and swelling, don't try to self-diagnose. See your doctor for help.